Central. We're going to go ahead and get started. Good afternoon, everyone. Welcome to the webinar, and thank you for joining this live talk brought to you by OpenText and Alitek Solutions. Special thanks to OpenText for helping to make this event possible. The topic for today's presentation is triaging healthcare communication channels with intelligent capture and machine learning. My name is Patrick Sterner. I'm a principal with Alitek Solutions. And for those of you who aren't familiar with Alitek, we are an OpenText partner and solution integrator. We've been in business since 2005. I personally bring over 18 years of delivery experience working with customers in the pharmaceutical, oil and gas, and utility sectors. My passion is helping clients adopt solutions that improve business processes through better management of information. I'm joined today by Aaron Nielsen, an Alitek architect with over 20 years experience driving EIM projects in the healthcare and life sciences sectors. Aaron has been kind enough to join us today to share a demo of OpenText Intelligent Capture. Aaron, can you briefly introduce yourself and describe your background?
Sure. I have been working with the OpenText products since 1999, so Intelligent Capture, probably about over 10 years of that. And so I'm gonna, like as Patrick said, show you a demo here of the healthcare industry, which I've implemented a number of solutions with. Thank you.
Thank you, Aaron. We appreciate you joining us today. Please note that this will be a short presentation. In the interest of time, we ask that you hold your questions until the end. At that time, and I'll prompt you to do this, we'll answer any questions submitted in the webinar control panel under the questions tab. Right. If you look to the control panel for this webinar, you should see a questions tab, which allows you to enter written questions. Also, please note that this presentation will be recorded and sent to all attendees afterwards. So without further ado, we'll go ahead and get to it. Okay. So within the healthcare ecosystem, communication channels tend to have their own lanes. I think the key thing to understand is that there's a wide range of communication channels, anything from fax to paper to email to mobile, each with its own distinct pathway into the organization. And typically what happens with those channels is that most of the time there is someone on the receiving end, a person who is responsible for manually triaging the information. That person's job is to classify the information to the best of their ability and then move it into the appropriate repository, anything from an EMR to a patient portal. And so after filtering through these various manual processing channels, the incoming information is translated into specific document types, which then drive business processes. So these are documents like new patient signups, referrals, claims, prior authorizations. They're all ultimately sent to users in the business to be actioned. Right? And so today we're going to talk about the complexity of this landscape and how we've taken it, added intelligent capture and AI into the mix, and streamlined the channels so that information can be received, get automatically classified, and get to the right person at the right time. So the demo that you'll see in a bit is based on a case study, which is really an amalgam of 3 organizations that Alitek has worked with. Those organizations are all hospitals, and like many hospitals, they have business units that operate in silos. And that's mostly because they've merged with other hospitals, and that's often how hospitals grow. Right? And at least in this case, sharing information between those silos was very, very difficult. In addition, like we've been discussing, each of these customers had multiple communication channels: fax, paper, email, electronic forms. And in some cases, they had more than one feed to handle the same documents, like referrals or prior authorizations. The key point is that each one used human assets to review all those channels as the information came in. There was no checkpoint of technology based on business rules at any point in the process. And not surprisingly, this was leading to missed SLAs. Each organization had SLAs tied to customer service, and the inefficiencies of processing documents, in this really complex manual process were just adding up and causing delays. And because everything was redundant, they also had a very high cost to operate. Every time they had to spin up a new application or a new fax line, there was a cost associated with that. Other challenges included managing various legacy systems and ingestion feeds. There were departmental solutions, some homegrown, some customized for just that department. One customer was utilizing the feeds to copy data, which led to data integrity issues and leaks. And then, as I mentioned earlier, there were the support costs. So whenever anything went wrong, there were so many possible points of failure to be checked that it was very time consuming. And then my favorite, not the last one because it's the least important, to me it's the most important, every single one of these customers had no way to report or monitor the data, so there was no way to understand where the peak periods were, how the data was coming in, where there were holdups, and if there were any novel situations occurring. So in short, there was a real lack of visibility coming into the organization. So what is the problem? The problem is the center of the screen in this slide. Right? On the left, the channels themselves are typically set up in a way where they operate in a very efficient manner, especially the newer ones like e-forums and some of the click-to-chat methods, because they've been well thought out. And just like today's fax environment, the technologies are pretty mature. And on the other side of the picture, we have the business units. There, all the processes are already in place for these folks to do what they need to do every day. And if they're not, typically it's a work in progress or something they have planned for the future. The problem is at the center of the screen. Right? So let's be clear, healthcare is about human beings. Right? The patients, doctors, nurses, and professionals that support the industry will always be essential. Right? They're an important part of the process. However, in this case, humans are spending a lot of time on low-value processing tasks, which are time-consuming and costly. So this human integration piece, where people are manually classifying high volumes of information, is a problem that is ripe for a technological solution. So let me pose a question. What if you could do the following things? What if you could accelerate prior authorization triage? It doesn't have to be just prior authorizations, but our demo today supports that. So we're picking on that as an example. As you'll see, we can automate the extraction of complex medical information from forms and physicians' letters. So this is something that's possible. What if you could save up to 80% of current spend by eliminating manual effort? Right? 80% was the average across customer examples that we were able to save them. And we were able to bring them into compliance with their SLAs. What if you could improve CMS star ratings? Right, so CMS.org is the star rating system, which is tied to plan responsiveness, care, and customer service. Even if your star rating is a 4 or at the top end of 5, you may be investing a high amount of dollars to achieve that star rating, and you may be able to reduce that cost by deploying something a little more efficient. What if you could improve patient care and reduce operational costs with real-time visibility? That's something that I mentioned earlier that's at the top of my list. And finally, what if you could free up critical staff? Right, we had a customer that utilized nurses to review some of the data that was coming in because they needed that skill set. So what if you could take the critical staff and let them focus on higher value tasks like helping patients? Right, these are just a few examples, but the solution you'll be seeing demonstrated today has the potential to do these things and more. Right? So as a healthcare provider, if a piece of technology could help you accomplish these tasks, what would the value be to your organization? What is it worth? Isn't it at least worth your consideration? So let's talk a little bit more about how we achieve those benefits. What is the solution? So in a few minutes, Aaron will show you the actual solution and how we did it. But just to keep it at a high level, we solved the problem by cutting out everything in the middle of this picture. We replaced the human integration with automation. Right? Specifically, we introduced 2 technologies, right? OpenText Intelligent Capture and OpenText Magellan. Right? So each solution brings something unique to the table. Intelligent Capture automates content ingestion, OCR, field extraction, and document classification. It's really the heart of the solution. So for structured content like forms, it's really all you need, right? However, for unstructured content like a doctor's referral, right? Magellan provides the natural language processing needed to read and pull actual concepts from the document. Magellan does things like text mining, tone and sentiment analysis, and concept extraction. And so together, these two solutions allow you to fully automate your communication channels. And you'll see examples of both in the demo today. Some really cool examples that Aaron will show us. So equipped with these two powerful solutions, we can fully solve the communication channel problem. We fill the gap left by human processors by integrating these solutions into your infrastructure and configuring them to monitor the feeds, ingest the data, make the documents searchable, classify them, and then move them into buckets where they need to be so that the folks on the right side of the screen can access that information. And it will still put it in the repositories that we showed earlier. It's just going to be classified and assigned to the right taxonomy or folder structure within those repositories. Just a comment, we think these two solutions work exceptionally well together, but for those looking to take the next step without being fully sold on the benefits of AI just yet, Intelligent Capture alone offers a very clear ROI, which can be quantified directly in terms of efficiency gains. So there are incremental gains to be had through a phased approach as well. Before I hand it over to Aaron, I'm going to leave you with this. Our goal is to get folks to focus on the higher value work, not the tasks around reading every fax that comes into an organization. So meeting your SLAs, freeing up resources to focus on helping patients, and applying those savings to innovation and operation. That's the goal, and it's what we see other healthcare providers doing to maintain their competitive advantage. Right. With that, I'll yield the floor to Aaron to demonstrate Intelligent Capture in action. So take it away, Aaron.
All right, thank you, Patrick. Make sure I'm, all right. Okay, so as Patrick was stating, this is a case study here. And this is an example. On the left-hand side here, we've got that a patient has come in and they're complaining of shortness of breath, hives, things like that. And as a result of that, the physician is requesting a food allergy test, right? So this referral request form is a structured form, right? It's got the table and it has places for all the data that's being placed in there. On the right-hand side, the physician also added an additional letter that was written by the physician explaining why this patient requires this procedure, right? This is unstructured. This is the case in which the Magellan piece can work and work with the data. All right, so then these two documents are then faxed or emailed to their specialist. And as we talked about prior, these incoming channels, there can be multiple that are supported at the, at the same time. You've got watching an email inbox, a watch folder that WriteFax is placing documents into. So that's what we're going to show here is in a couple of the solutions that we had, WriteFax was dumping them to a shared area in which we were watching. The Intelligent Capture product will then watch this folder for incoming faxes. In this case, they happen to be TIFFs, right? So I'm going to place these here in my watch folder that I've configured. Again, you can have several of them. You can have 10 of them. You can have as many as you want. It's very configurable in that case. I have it configured to pull within look every 5 seconds, for instance, right? So it's going to take those two documents, and this is where that black box happens, where the Intelligent Capture product is going to determine what document type it is. It's going to take that TIFF image and it's going to make it a searchable PDF so that you can perform searches on it, and also pull out and extract metadata associated with that. Okay, so what I'll do next here is show the web client. So this is the Captiva Capture web client. As part of this, as part of the process, these can be automatically triaged to your EMR, such as the OpenText content server product, that sort of thing. But what we're showing you here is what happens behind the scenes. Okay, so this is the batch of 2 documents that came in, and you're looking at the Intelligent Capture web client. This could be skipped. This is not something that needs to be visited in this point in time, but this just kind of gives you, if there needs to be checks and balances before it's triaged to its areas, someone could come in and do some checks and balances here without having to open up every single document. You can see it recognized that the first document is a referral form. We set up that as a document type. The second one happens to be a referral letter. So those were automatically classified by the intelligent capture product. And so I'm going to go ahead and hit next, which will then show you the metadata that was pulled from these documents. So for this one, we had set up when I receive a referral form, and these could be set up per vendor coming in. They have their own types of forms that have a look and feel. This isn't saying Nancy Drew needs to exist on this part of the paper. What it looks for is it looks for the value of name, and it looks to the right, it looks down. There's a lot of intelligence, hence the intelligent capture product. There's a lot of intelligence that goes into these forms. It's not just this hard coded, it must live in this area on the form. So what you're looking at here in terms of the name and the date of birth and such, it's looking for a label, right? It's looking for a label to determine what these field values are, right? So we could go in here, and this is where you can capture someone's ID, right, for their insurance, for instance. And that could also be searching and getting information from an external system and pre-populate things within here. It can be done here or as well as in your EMR. Generally, your ID is going to be determining where it's going to be exported to in your EMR, right? So you find out what that identification information is. That's extracted using the intelligent capture product. The next document, obviously, is the letter. This is where the Magellan product comes into play. So this shows an example of where it took the entire letter and we fed it to our engine, and it determined based on the concepts and the symptoms that this fell into the peanut category, peanut allergy category, right? And another interesting fact is in terms of symptoms, dyspnea and urticaria are those normalized terms in which were not actually spelled out in here. You saw short of breath in here, hives, and it used the medical terms for these. So that helps with, again, in your destination system, if you're searching for documentation related for a particular patient related to these types of symptoms, as opposed to free-form text. So that normalization is very important in helping diagnose patients as well. It also pulls out these concepts, people, organizations. So these are all things that are built into the Magellan product, dates. And this is where Patrick had talked about the sentiment and the tone. So the way this is done is it takes each sentence within the amount of data that's passed to it. In this case, I took all the text and I fed it to Magellan. It read each sentence and determined that overall, the sentiment is an opinion. And that's what we're seeing here. And then same with the tone. It became negative. And that can be helpful, at least with the tone, for the priority. If it's a negative tone, maybe we make that a higher priority when we push it to the system, or it goes to someone else's specific queue because it's a negative tone, and we need to take a look at those quicker than those that are not, right? So once the user has taken a look at these, they'll go ahead and complete the batch, and this is when the export will occur. So the export, again, is very configurable in that we can export JSON, XML, the actual PDFs, of course, and they can be fed to, like I said, OpenText content server. It can be fed to SharePoint. So that is very configurable within the intelligent capture interface. What I'll show here, I have on the second tab here, this is OpenText extended ECM. I had set up a folder, and so the rules within intelligent capture, where if I saw a form, I'm filing that into the form folder and also specifying the metadata associated with that. So here is my form. I can name it whatever I'd like. If we grab the patient name, the name of it could have been the patient, it could have been their ID, whatever it's determined within the EMR. So those requirements are very specific for each client, obviously. And so you can see that the properties are all mapped, right? We map the metadata that's required. So from the system. So this allows you to be able to search on metadata on the documents that come in. It is also a full text searchable PDF. I'll just go ahead over to the referrals just to show the letters that was filed under that folder. I'm going to go ahead and download this here just to show that, you know, the first one was indeed an image. So you didn't have the capability of searching within it. So in here, this is a full text searchable PDF right? And that's what it is also within the content management system here, to perform searches and find the information that we needed. So it just determined, most of the time, it's going to be that black box that everything's going to get triaged automatically. But it was important for me to show you guys how did it get all of that metadata out, and how did that intelligent capture product do that? Because it is somewhat of a black box that performs that information. So that is all I have, Patrick. I will pass it over to you.
Okay, thanks for that, Erin. Great job.
Yeah.
So at this point, let's go ahead and open up the floor to a few questions. So in the control panel for the webinar over at the right, you should see a tab that says questions, and you're free to type those questions there. We'll give everyone a minute or so to go ahead and do that. And there's a good number of folks on the call here today, actually. So if folks are wanting to ask their questions offline or later, we'll provide contact information here in a second. So let's go ahead and do that. And as we wait for folks to enter their questions, I'll go ahead and reshare my screen. Okay, any questions? Going once, going twice? All right, great. So we'll go ahead and continue on with the presentation. So since there's no questions, we'll go ahead and proceed to wrap up. Let's see here. So as we near the end of the webinar, I'd like to take a moment to summarize what we've seen here today. So with Intelligent Capture and Magellan together, we saw how organizations can automate the triage of incoming communication channels, but also take the revolutionary next step of interpreting unstructured content, just like Erin showed with her peanut allergy example. Right? So Intelligent Capture allows you to analyze incoming channels like faxes, understand what it is, make it searchable, and if it's more structured, automatically extract out all the components that are important. But at the same time, for those things that are less structured, be able to have Magellan do some analysis of it to tell you what's happening from a language perspective. What is the extractable knowledge? What is the document about? Most importantly, there's an area here that gets into AI. So whenever you get to these moments where you want to train the system and have it learn, so start with out of the box, and as you use the system, it becomes smarter, right? You can train the system with an example of what good looks like. And then as time goes on, whenever something falls out of the norm or is not quite right, you be able to have a business user go in there and give it the right answer and have the machine accept those changes and learn from it going forward. That's where you start getting into this idea of artificial intelligence with natural language processing. So speaking to a larger trend, we see process automation, AI, machine learning as huge growth areas for EIM, enterprise information management, in the next 10 years, right? Many companies, COVID provided a real life stress test of their processes. And many companies thought they had durable processes in place, but they realized just how much they were leaning on their workers to keep even simple things moving forward. Right. So the goal in the future will be to automate those repetitive tasks and let people focus on parts of the process where they provide the most value. Right. So at Alitek, we have a mantra: all business problems are information problems. When we help customers solve problems, we always approach it from this perspective by understanding both the challenges and the information needed to solve them. Right? So companies like Google and Meta maintain their competitive advantage by understanding their own data. Other companies must do the same thing. And that's where I think Intelligent Capture and Magellan fit with this larger goal. They allow healthcare companies to see their incoming communication channels, to understand their data, and it's that visibility which leads to actionable insights. We hope you'll agree. So I'd like to thank everyone who participated in today's presentation. Thank you, Erin, for offering your time and sharing your insights. I feel like I've learned a lot. It's clear that Intelligent Capture has much to offer in the healthcare space. I'm sorry that our time is so short. So for anyone who would like to learn more, please don't hesitate to reach out to me. Again, I'm Patrick Sterner with Alitek Solutions. My contact info is featured on the slide there. We will have a recording of this presentation and we'll send it out to all the attendees. We'll also post it on the Alitek website. So thanks everyone who attended, and have a great day and a happy holidays. Thank you very much.
Thank you.